Everybody, my name is Larry McClendon, CEO of National Insurance Agency, and for the last 2 decades we have made it our goal and desire to make sure that agents and associates that are selling here at National Insurance are very well trained, very well paid, which means we try to pay everyone daily. If it's in before 11, it'll be paid the same day. If it's after 11, it will be paid the day after. So very simple procedures on that, but what I wanted to go over today, which is a little more important and it's looming right around the bend, is the ACA, Open Enrollment. We have about 2 weeks to go before Open Enrollment, and with that said, there's a lot of questions still out there. The carriers are not letting us really see their websites of how to quote and what the subsidy calculators are looking like. I've seen pictures of them, we've seen snapshots, but all in all, what we need to know is to make sure that you know and are able to spend on a dime whatever it comes out looking like. We've had you practicing on the Kaiser subsidy calculator and other similar calculators. We actually have a new private exchange that I just received yesterday that I'm going to take a look at as well. But in going over that, yesterday we had a webinar that was really a good one, and it was talking about planning, organizing, directing, and controlling. You've got to plan your future. We can all do nothing. We can accomplish nothing. We can do that by ourselves and really be mediocre to a failure. And as we all know, failure comes naturally. We can lay in bed, it's raining today, stay in bed and stay home, do nothing, and make no money. But sales is one of the greatest industries in the world because it's all up to you. The harder you work, the more money you make, and success is a choice, and it's your choice. How good do you want to be? How much do you want to make? So what's a good solution? I know some of you may feel very isolated out there. I know I feel a little isolated right now. Some of the carriers are so busy training all over the country. I'm trying to pull all the data out of them that I can get to give to you so that you don't feel that fear of, I don't quite know, or I don't know where to go to do this, I don't know the answer to that. That's why I'm here today, to try to help you. We've all felt it. We've all felt a sense of insecurity, so I know really how that feels, and I know where that comes from. So today I'm going to talk a little bit about, in every job market, there's structure. So if your office and your team are operating without the planning and the organizing, the directing, and the controlling, you're really operating by the seat of your pants. So, and we know sometimes people do really well by the seat of their pants. You know, you can look at Google or the people that operated out of their garages, and it just happened to hit, and they're multi-billionaires now. Those are one in a few. So, but it really takes a lot of hard work and a lot of effort. I've always said I'm not the smartest or the sharpest tool in the woodshed, but there's not many people who can outwork me or outthink me or work harder than I can, or longer hours. So with some of the longer hours and the dedication, I've made a pretty good career, and we've built a pretty good company that we think most of you would be very comfortable in working with to build your career and your future. So rely on us to help you. So what I want to go over here in this next segment is getting away from flying by the seat of your pants, and know that you're not unprepared. Know your numbers, and so by knowing your numbers, know your market, know your products. In the center of this circle, I'm going to have the, can you hand me that marker there? We are going to talk about marketing. That's your main goal right now. Marketing. Okay, what comes into that? Advertising. And you can go off the chute all different types of ways. Location, internet, product, research, strategy. And I'm not going to bore you with all of that, but it is the essentials of marketing, is to know your product, know your strategy, know your advertising, know your branding. Have you gotten your place set up where you're going to do your marketing? Have you got your internet provider? Do you have a wireless laptop? Do you have an iPad? Will the iPad work with the Assurance system? Will the iPad work with the United system? These are things that are all big questions that you may not have thought of. Have you done your research on that? your strategy. Have you got your A-frame signs to put out on the sidewalks to have a lot of foot traffic come into your little shop? Or your, I know we have several agents that are going to be in several independent pharmacies, and we're paying to have a booth inside those pharmacies so that as people walk by, we're enrolling them. And subsidy or no non-subsidy business, one great thing that you have here working at NIA is we're going to pay you every single day based on full commission, whether it's subsidized, non-subsidized. Even if the consumer does not pay $1 or 1 penny for their own health insurance and the government is paying all of it, we're still paying you on the full premium daily. So we're going to wait for our money to come back and wait for our money to come in from the carrier, but we're going to make sure that you get paid every single day on all of these cases. So first of all, what I want to talk about is the ACA Commission, and I'm going to go with like a middle of the road, not the level 1 agent, but a level up. And I ran some of the numbers yesterday, and first off, I wanted to mention that right now short term is a great alternative to an ACA. We're looking at the middle class right now that is slowly becoming the new uninsured. If they're very, very poor, they're Medicaid eligible. And so that's really not our market, not where we want to be. We want to be a step up to where we can help them with a subsidy, and then you're back into the business of the commissions and then the supplemental products. But then you have a middle class who don't qualify for a subsidy. Then they can't afford the ACA rates. So short term is still a great answer until they can figure out what to do. You can do an 11-month short-term plan with doctor visits and copays, and really the wide assortment of plans on short-term is amazing. And we have an agent right now who I just saw a renewal check go out for just shy of $16,000 for his monthly renewal. And that's not, he's riding on the cusp. He wants to submit his business after he gets his advances so that it doesn't pull away from the advance. He's right on that cusp of breaking. I think once he breaks, he will be a happier man, but he's very happy now because he's getting the advances on one side, he's getting the renewals on the other side, so he couldn't really be happier. I know our commission department is working with him to try to make sure they submit his new business after a certain period so that he's watching his account very closely. Let's just leave it at that. So that he's getting full compensation on both sides of it, which, you know, we don't care. He's working it well. He's doing a great job. So let's talk about the ACA for a moment. And I'm going to do a 36-year-old male, a 36-year-old female, and 2 kids. And be sure and let me know when the time you think is right for this to be on line. So, okay. I have Vanessa in here helping me, and she is going to help guide me on some timing because we want to get this out to you guys. Okay, the ACA plans. I did some numbers. Okay, and let's talk about, I'm going to do right now Assurant Health. Right now, Assurant Health is using the ASA Signature Network. They have over 100,000 providers. There are no skinny down networks. There are no skinny HMO. You do not have to go to a gatekeeper and get permission. Say, doctor, I have a rash on my leg. I think I need to go see a dermatologist. Okay, we're going to charge you a copay. It's okay for you to go. Assurant's not doing that. You go straight to your specialist. You still have your choices. And a lot of people want that option. They know what they need. And they know what they don't need in most instances. They don't need to go to a gatekeeper. All this is done and set up by the powers that be to slow down the healthcare and slow down the costs. So we kind of all know that. But we're going to do an ACA, a male 36, female 36, and 2 kids. All right, and this is in the 75 Dallas area code, which is a pretty much a fairly middle of the road zip code. So the bronze plan with a $6,000 deductible. So let's just go with bronze. $6,000 deductible. Perfect example of where you need to include an AME, an accident medical expense plan for, you know, maybe $1, a little less than $1 a day on that family. This plan is $954 a month. Okay. So the commission on the bronze plan would be 7.5%. All right, that would be $72 a day. I'm sorry, $72 a month in renewal commission as it's paying in as earned. We're going to accelerate that and advance you a 12-month commission and turn that into an $864 payday. Okay, and not a bad payday. So there's not a lot of selling right now going on with ACA. It's just enroll, 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 enroll. I mean, how many can you enroll in a day? How many people are you going to see and visit with? How many are going to walk into your storefront that are just enrolling? Now, the assurance system, I know how it's going to work. You're going to enroll and log into it, and you're going to enter in your customer information. It's going to reach out and grab the subsidy calculator and grab the authorization from the health market. It'll pull it back, and then you'll complete the sale in the Assurant Health Ease platform. So one of the nice things about it and being able to do health plans through the carrier's website is daily payroll. Some of our competitors pay weekly, some pay bi-weekly, some pay monthly. We choose to pay daily. I know our sales force is highly spoiled at that, and sometimes you think that they're dying if they don't get their payroll in one day, but that's okay. That's why we built it that way. We want them to like us and need us and want to make more. So, okay, that's a bronze plan with $864 in commission. Okay, now let's go over a silver plan. The silver plan has a $2,000 deductible, and the reason I'm going to do it this way is I want to show you what the AME is. I'm going to just do a silver here. Okay, for this same couple, that premium would be $1,164 per month. Whether they pay a penny of that or whether the government pays it all or they pay a portion of it, it doesn't matter to you or to me or to Assurant. The commission is the same. So this is with a $2,000 deductible. So again, you're going to need that AME plan to help them, because when you have, let's say they're not paying a penny for this, that family is going to need an AME protection, because $6,000 may as well be $60,000 to them. They need to get in there and see their doctor visits. They need to have an accident, get into the emergency room. All those types of things are covered after the deductible. So we need an AME in there to cover an accident or a situation that might pop up with this $2,000. A lot of people have a $2,000 or a $3,000 deductible. I personally have a $3,500 deductible, and I've yet to hit it. So I'm sure there's a lot of people that are out there like me. So this silver plan would be paying $87 per month towards the renewal commission. Okay, we're going to accelerate that to you. 12 months the next day, and that would be a $1,044 commission. Okay, now we're going to go to a platinum plan, and believe it or not, you would be shocked at how many bought platinum and gold last year, because those who don't qualify for a subsidized plan, they can afford it, they want a zero deductible. This one has a zero deductible. Zero. So very good plan, but the premium, they're paying a premium, $1,600 for this same family, $1,632 per month for the plan. Okay, that's paying at $122 a month renewal, and we're going to accelerate that to you for 12 months the next day, and that would be $1,464 commission. Okay, so there's the difference. I'm going to leave, what I'm going to do is leave up here the guts of it with the silver and the commission, and I'm going to go back and show you with some ancillary benefits what you could add to this. I think I'm just going to go off of erase all this, start over, make it a little simpler for you. Ancillary benefits are huge right now. Okay, here we go. AME, which I just mentioned a couple of times, with a $10,000 AME. Okay, that would be, for this family, would be $53 a month. Okay, that is at a 56% commission. That would equal $29 a month. Okay, we're going to accelerate that $29 to you times 12 months equals $348 worth of commission, and on top of what I just showed you for the bronze, silver, or gold, or platinum. Heart attack, cancer, stroke. Heart, cancer, stroke. Okay, the cheapest plan for this, I did a $10,000 benefit just to kind of match the AME. It's $9, $9.95. I mean, really, if you can't get a $9.95 in there for someone who's on a subsidized plan, you know, you really need to rethink your position on. I'm on my board turning. Okay, think your position on creating the need. We have to create the need. So this actually would only be a $6 a month renewal. However, we're going to accelerate that to you times 12, and then that would be $72 additional tacked on to your commissions for the day. Okay, now we're going to move to a critical illness. This is the big daddy. 90% commissions with Assurant Health. 90%, and this is middle of the road, so it goes even higher for you guys that are up there. So I did a $50,000 benefit for, first I do, here's the way I handle it. I usually go with the income earner. In today's world, most couples and households have two family members earning the income. But generally on the husband, he's the one with all the stress. He's the one that's going to have a heart attack and die and leave his wife so she can marry somebody else and leave her with all that money, right? But I'm just kidding. But typically we do see a lot of females that are outliving their husbands. My family is just the same way. With a $50,000 benefit, the premium on that is $46. $46.05. Erase that right there. Okay, so we're going to accelerate that commission to you for 12 months equals $492. And so here's where I kind of fall in the line with client, and I talk about, well, Mr. Johnson, since we're going to put $50,000 on you as the husband, wouldn't it only be fair to put $50,000 on your wife? Is she what she does around the house, even if she is a housewife, which is a tough job, or if she's earning an income from outside of the family? Critical illness pays on diagnosis, so it's a major cash infusion at the worst time possible. Believe me, my family lived it. It was one of the first things that paid, and we were thankful that I had sold it to my mom and dad over 19 years ago. And never ever thought we would have to use it. I never thought, I could imagine, but we did. So if you can talk the husband and the wife into saying, okay, if he is worth $46, isn't she worth $46? Very simple. Add another $46 to it, and then that's another $492 to this plan in your commission. That's a lot of money. So if you took the commissions from the bronze and the gold and the platinum and the silver plans, and then you add on either $348, $72, or in this case this is $984, and let's say, how many can you do in a day? I've talked to a lot of my co-workers that are fellow MGAs and fellow key brokers. Most of them that had storefronts were doing from 30 to 40 a day of walking in the door. And then if you're advertising, or if you have a dialer, or you have someone standing out on the corner flipping the little board saying Obamacare enrollment's here, anything you can think of, banners on your car, on the back of your windows, get the people calling you. It's all up to you. Don't be shy and don't be embarrassed. And don't, if you don't know something, you please call me and call us and let us help you get the answer to it. There is no question too silly, no question too that should embarrass you, because there's a lot of things to this date that I still don't know, that I still have a question on. In fact, I just sent an email to both United and Assurant to find out a question on something that I still have a slight question to. So I'm going to follow up this with one more product before we go and sign off on this little training webinar, and this is on dental. Assurant Health has the highest paying dental in the market, bar none. Some are trying to catch up to them, and some are getting pretty close, and we'll go over those in another training. But right now, I'm going to talk about the Assurant Dental for that same family, 34 with 2 kids. Okay, I went with level 2. We had level 1, we have level 2, and we have level 3. One of my good friends did a great pitch the other day on a Friday, and I happened to catch it, and he didn't even know that I caught it. And I was really so glad to catch it, because I thought, how good is that? He said, and we've all done this, we present 3 choices, because typically, if you're a buyer, when you're buying, you want the cheapest. If you are a user and a consumer, you wished you would have bought the most comprehensive and the very, very best. But generally that doesn't fit either scenario. So you've got to find somewhere in the middle to land. Here, 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 here with a level 2. Doesn't that make sense, Mr. Consumer? Yes, it does. Okay, so you're not giving them choices to overwhelm them, saying, let me think about it. You're trying to help them with the best decision and a quick decision. So I went with a level 2 on dental, which was very inexpensive. With Assurant, it's only $26.50. Okay, so the commission on that is 55%. Huge. That equals a $15 a month renewal. We're going to accelerate that to you by 12 months, and that would pay you $180 additional on top of your health plan, your CI, your heart attack, stroke, and your accident. So there's some other products that are on there that we will go over on another training, but I wanted to just let you know that right now, think about the commission. Think about the products that you want to represent. Think about focusing and focusing and focusing on, if I get on this ACA bandwagon, and if I get a quote engine like some of the big quote engines out there say they have over 300 carriers, bully for them. Half of them pay, maybe some of the carriers are paying nothing in some states. Some of them are paying $18 an application when the quote engine's charging $25 an application just to submit it, so you're losing money on every deal. I say stick with the carriers that are making you the money. That's why I'm doing this training. That's why I'm trying to show you my belief in how to make a great living in this change. Some people believe chaos is a chaotic time. I'm one of those that believe in chaos. Those that climb to the top and rise above it are the ones that create common sense in a very confusing time, and they're the ones that come out and prevail. So with all that said, I wanted to wind this down today and let you know that we at National Insurance intend to pay you every single day. We're going to pay you the very top commission, and we're going to make you have a very, very good time here trying to maximize your commissions. And one thing before I sign off, I want you to go to our agent portal, which is www.besthealthquote.net. Okay. Reason for it. We've just added a new tab, and it says pre-enrollment. Okay. Well, sorry about my writing. So you can click on that tab. It will ask the name, the email address, their household income, how many are in there, all those pertinent questions, and it will shoot an email to your client letting them know that you are their agent. You've got them under control. If another agent calls them, to let you know that you have pre-enrolled with Mr. John Smith agent, and you're ready to go come enrollment period, so that another agent or however many other agents call them, you have pre-enrolled them. So it's going to shoot an email to the consumer, and it's going to also shoot an email to you, the agent, where you can save those, keep those in your folder, and be ready to quote those people, and not have the quotes already ran, have them ready where you just call them and you're just enrolling and enrolling and enrolling and enrolling. As the 15th, as 12:01 strikes, you will be ready to begin enrolling. So with all that said, I hope you had a understandable time with me today, and I really appreciate you taking the time to watch this video, and more to come. So stay tuned. Thank you.